Excuse me, Dr. Matthews. Hi, I'm Emily Liu. I'm the weekend med-reg. I called you this morning about the patient who came in overnight with respiratory failure.
Ah, yes.
I was just wondering if I could bring you up to speed and maybe talk about a care plan if you have a moment, please.
You're not the one who woke me last week about someone being transferred from Merriwa, are you?
No, that must have been someone else.
Well, I hope you have more on your patient for me than they did. I arrived here in the morning expecting to see a stable patient, but he was barely alive. No notes to speak of, no plan. When I tried to call the registrar, all I got was a ubiquitous message bank. We spent the rest of the morning resuscitating the poor man. Anyway, that's nothing to do with you. So you're...
I'm Emily.
Emily. Well, what's the story, Emily?
So Mr. Baxter is a 62-year-old man who's presented with a probable pneumonia. He was brought in by ambulance this morning around 4 a.m, feeling unwell with a fairly rapid onset of shortness of breath, SATs of 90% on room air, but he's presently stable. By way of background, he's a generally well man with no significant past medical history. He's on antihypertensive medications only. He's a non-smoker and a social drinker. On examination, his heart rate was 112, his SATs were 90%, as I said before, but he was actually afebrile, and they couldn't hear anything on his chest because he was so tachypneic. His blood tests have been pretty much normal except for a slightly elevated white cell count. Chest x-ray was patchy, but it was a mobile film done in the emergency department. We excluded an MI with an ECG that just showed a sinus tachycardia, and his serial troponins were negative. But he does actually have this history of just coming back from a long driving holiday a couple of days ago. So the overnight med-reg thought that he might have a pulmonary embolus and started him on some therapeutic Clexane. Now, this morning he looks a lot more comfortable. SATs are 96% on 2 litres of oxygen, but his CTPA was actually normal. So I reviewed him again, and well, since admission he's actually developed a cough, right-sided pleuritic chest pain and a fever.
Right, so...
So I think he's got a pneumonia, even though he doesn't present with any history of fevers or rigors. So I'd like to repeat his blood tests, get a formal chest x-ray. I think he should only be on prophylactic Clexane, and I'd like to start some antibiotics as per guidelines.
So that's your plan?
Yes, if that's okay with you.
Sounds right. Has his first x-ray been reported?
Oh, no, not yet.
Call me if the next x-ray shows anything unexpected.
Yeah, sure. Thanks, Dr. Matthews.
Good story. Well done. Is there anything else?
Oh, no.